Welcome back. Thank you for joining us again. This PowerPoint presentation and the accompanying narration was designed for East Texas Baptist University for use in the course Criminal Justice 3314 Criminal Investigation, and I'm Dr. Eric Hillman. In this class, we use the textbook Criminal Investigation, 11th edition by Hess, Orthman, and Cho. The student's viewing of this presentation is designed to supplement the reading of the text and not to replace it. Chapter 10 is entitled Sex Offenses. Chapter 10 has been divided into shorter segments for easier online viewing. This is Chapter 10D, the fourth segment of Chapter 10. Experts have developed rapist behavioral profiles, and they have categorized rapist behavior into four categories. First of all, the approach that the rapist uses. How does he approach the woman? The control the rapist uses. How much force, if any? Number 3, verbal. What does the rapist say? And category 4, sexual. What does the rapist do? So let's look at the first category, approach. There's several different approaches. One is called the con approach. This is a con man. He's friendly, he's charming, and the victim is sometimes duped into trusting him. He doesn't make his move till later. The blitz approach, on the other hand, the offender directly assaults the victim. Often in the blitz approach, the victim is bound, gagged, blindfolded, tied up with ropes or duct tape. The surprise approach is where, as the name implies, the rapist surprises the victim. Sometimes he'll look for unlocked cars and hide on the floor of the back seat, knowing that oftentimes a woman will get in her car with her maybe hands full of bags that she puts in the trunk, or if she does not carrying something that she just doesn't notice. He may hide in the bushes outside her home or her apartment. He may actually get in the house or the apartment and hide. Wait until the victim's alone. If someone else is there, wait till the second person leaves, or wait till the victim is sleeping and then jump out of the closet, surprising her. The second category, control. Some rapists use what's known as mere presence, which means that their presence is so intimidating and the woman knows what he wants, and she's so scared that she doesn't resist. So his mere presence is enough to commit the crime. The next level up would be verbal threats. Don't move or I'll hurt you. Next level up, display of a weapon, whether a knife or a gun, which convinces her to submit to what he's doing. And the highest level being physical force. And I've got physical force in bold here because there's different levels of physical force. So the second category is control. There's different levels of control. The highest level is physical force. And then let's look at different levels of first level is minimal. So in every level here, obviously, he's using physical force. So slapping her. She resists at all, slap her across the face. Moderate would be repeated hitting, multiple punches. Excessive would be beating her until she's cut, bruised, and bloody. And the highest level is what we would call brutal, and sadistic torture would fall into this category. He wants her to feel terrible pain. Sadistic meaning he enjoys seeing her in pain. Category 3, verbal. What does he say? He may make threats to kill her, to hurt her, to embarrass her. If you resist me, I'll kill you. If you resist me, I'll beat the living out of you. If you resist, I'm going to take pictures of me raping you and put it on the internet. I'm going to come back and rape you again. He may make demands of her that she beg for her life, that she scream, that she say certain words. All of these are questions that you as an investigator have to ask, because this is how you develop the MO or modus operandi. He may demand that she say certain words. Yes, you were wonderful. Yes, you're a real man. That she affirms his virility. Tell me, you've never had anyone better than me. Or affirm his virility in some sense. Force her to say that she enjoyed it. Personal inquiries. He may ask her about her sexual history, what she enjoys, and demand again that she say that she enjoyed it with him. He may reveal things about himself, like his own sexual history. Sometimes rapists have been known to reveal sexual abuse that they suffered, and he may even talk about prior victims. He may call her obscene names or demand that she use obscenity. And the fourth category is sexual. What does he do? Does he demand and attempt and succeed at forcing her to engage in vaginal sex or anal sex or oral sex or digital molestation? Does he seem to be experienced and know what he's doing, or does he seem to fumble around and not know what's going on? Does he destroy or remove evidence when he's done? Does he order the victim to shower or douche to destroy that evidence? Does he take trophies? And we've talked about that in an earlier segment. In criminal profiling, experts have developed 3 psychological profiles of rapists. The first one, power rapists. The second one, anger rapists. And the third one, opportunists. We'll talk a little bit more about each one of these. Let's look at the first category, power rapists. Power rapists are divided into 2 subcategories. One, manhood reassurance. This is where he's trying to confirm to himself and convince himself, yes, I really am a man. So he's got some self-doubt. He often uses stealth and sneaks up on the victim. The second power rapist would be manhood assertion. He's trying to assert to the victim, I'm a man, and he wants her to believe that he's a real man. He often uses the con games, fooling her at first and then raping her when the right time comes. Second category is anger rapists. 2 subcategories here. First, retaliatory or punishment rapists. They want to punish women based on anger they have towards women, often anger towards their own mother, sisters, former girlfriends, and they'll often use a blitz, rushing her, tying her up, using rope and duct tape, etc. The second subcategory of anger rapists would be excitation and sadism rapists. They are the most cruel. They often use a weapon, And of all the categories, they're most likely to kill their victim. Again, sadism, meaning enjoying someone else suffer. And the third category would be an opportunist. They just want sex. They see an opportunity and they take advantage of that opportunity. When rape victims complain about the police, what are their complaints? They complain that officers sometimes question the validity of their rape claim before they hear all the facts. Sometimes it's best just to listen and take notes. Save your questions till later. Officers that complain are sometimes aggressive and rude. This is a very emotionally trying time for her. Of all the times for you to show compassion, this would be it. Officers sometimes fail to explain procedures. Maybe she thinks that after this interview, that's it. The police are going to leave, and she doesn't understand. The next step is to go to the hospital and be examined by a sexual assault nurse examiner. And then she may have to go, if the rapist is identified, she may have to go to a lineup. She may have to testify in court, things like this. The police officers sometimes express a negative attitude about the victim's appearance, clothing, or actions. So maybe she shouldn't have dressed that way, or maybe she shouldn't have walked down that dark alley. But we never go to the point where we blame the victim. Now, if you have a daughter and she's dressed in a way that's going to attract attention from the wrong element of society, you may tell her to change her clothes. You may tell her she's got a 10 o'clock curfew. But when someone's already been a victim, this is not the time to be judgmental. And rape victims complain that police officers ask intrusive questions too early in the interview. You need to establish rapport, establish understanding, establish compassion before you start asking very intimate and very intrusive questions. Certainly those questions have to be asked, but building rapport first is very important. At the scene, in larger departments, you will call a crime scene unit to gather this evidence, but in smaller departments, you may be required to do all this yourself. If the rape happened on a bed, you want to take the sheets, pillowcases, blankets, anything that could have DNA, semen, blood, hair on it. You've got to gather that as evidence. The clothing she was wearing when she was raped, you want to gather that. Sometimes the rapist will force her to disrobe or partially disrobe, and that she'll already have that clothing off or other clothing on, but while she's waiting for you, she may have thrown that in the washing machine. You need to make sure that she doesn't start the washing machine. Now, this is outer clothing. You're not going to gather her bra and panties there at the scene. That's something that the sexual assault nurse examiner is going to do for you. If the rapist used a condom and left it there, either in the trash can or something, you want to gather that. That's got valuable evidence in it. And even if he takes the condom with him, with the evidence, the ejaculate, he still may leave the wrapper there, and the wrapper is going to have fingerprints on it. If she has visible injuries, you need to take pictures. If the rapist has slapped her, pinched her, choked her, and she's got marks on her face and arms, you want to go ahead and take those pictures. However, if she has injuries to the pubic area, that's something that you as an officer don't photograph. That's something that the photographs will be taken by the sexual assault nurse examiner. Anything that the rapist touched, you need to gather as evidence because it could have DNA and or fingerprints on it. Have her go through chronologically everything he did, because you don't know what he might have touched. Maybe there's footprints either outside in the mud outside her door or window, or possibly with mud on his shoes when he walks in or kicks in the back door, or finds the door unlocked, and you'll find muddy footprints on the kitchen floor. If he ejaculated, there'll be semen. It could be in a condom, but it also could be on the bed, on the sheets. Some could be inside her. Some could be in her underwear. Any kind of blood, if there's a fight, she may be bleeding, but he may be bleeding from a fight. And some of that blood may be his. Saliva, if he kissed her in any area. Hair, both hair from his head, but also pubic hair could be present. Now, if there's pubic hair to be gathered from her pubic area, you let the sane nurse do that. But pubic hair on clothing and on the bed, that's something you can gather. Fibers from his clothing could be there also. Soil samples from his feet. Any weapons that he used. If he brought his own gun with him, he'll likely take it with him when he leaves, but he may use a weapon of opportunity, something, a kitchen knife in her kitchen, a baseball bat, whatever happens to be in her apartment, and then he may leave that there. So you want to gather the weapons, not only to collect fingerprints and DNA, but also to use in court to show the use of force. Any signs of a struggle should be photographed, because if he's caught and he can't deny that that's his semen, then his next line of defense is, it was consensual. We met at the bar, she invited me to her place, and it was consensual. And later on, she found out I had another girlfriend, so then she claimed I raped her. So, first line of defense for a rapist, I didn't do it. But if he's left semen at the scene, and that proves it's him by DNA, he can't say I didn't do it, then he has to say it was consensual. So signs of a struggle and signs of weapon are evidence that it wasn't consensual. What about family members? Should they be there during your investigation? The general rule is you do not want to allow family members to access your scene. They may contaminate the scene or destroy evidence. They could destroy evidence accidentally, not realizing the importance of the evidence. Or they may destroy evidence intentionally if it's a family member. A dad or a mom or another family member might talk the victim into not identifying the perpetrator. Maybe it's a cousin. And the mother says, well, we don't want the cousin to get in trouble. It was a bad thing he did that he raped my daughter, but we're going to just not get him in trouble. We'll just tell him he can't come over here anymore. Well, obviously, that's not sufficient, but family members, if it's a family member that's a perpetrator, then other family members may pressure the victim not to say who it is. They may blame the victim. I told you not to wear that dress. I told you not to go out to that club. It's your fault that this happened. Trying to shame her, blame her. If she has a husband or boyfriend there, his anger might be out of control. He did what to you? The rapist did what to you? I will kill him. I will kill that MF. And with him out of control, you're trying to show professional compassion to the victim. He can really ruin that for you pretty quick. And the victim might hide details. Maybe she knows what her husband or boyfriend's pet peeves are, and if she admits that the rapist did X or Y to her, she might know that her husband's just going to go crazy over it. And so she won't tell you all the details because he's there listening. So get it in a place of privacy to interview your victim, even privacy from family members. After the brief interview at the scene, and if you have more than one officer will take her to the sexual assault nurse examiner while the other gathers all the crime scene evidence in the apartment. The sexual assault nurse examiner is specially trained for sexual assault exams. She will have in the hospital rape kits. I say hospital, it could be a doctor's office. But rape kits are designed and put together especially to collect evidence from rape victims. And it is the SANE, sexual assault nurse examiner, who will collect intimate evidence. If there's the rapist's pubic hair is found in the pubic area of the female victim, it's for the SANE to gather that evidence. If a semen sample is taken from inside the victim, that's the nurse's job to take that evidence, not the police officers. She will also take intimate pictures of injuries to intimate areas of the woman. She's going to test the woman for STDs to see if the rapist has given her any kind of sexually transmitted disease. The evidence that she gathers will be turned over to the officer or detective. In the old days, the officer had to be in the room witnessing this, but nowadays, generally speaking, as long as you established your chain of custody, it's not necessary for the officer to be in the room when this exam is done. However, you do need to document chain of custody. Who did the exam, who collected the evidence, and who turned it over to the officer. The officer then documents the chain of custody, turning it over to the evidence room, and then the crime scene unit investigator documents the chain of custody at the crime scene, and they're both turned over to the crime lab, and the person in the crime lab who analyzes all this evidence has their name on the chain of custody also. A sane nurse uses a colposcope. That is a scope that has a lighted magnifying tool to detect small cuts and bruises. It's equipped with a camera. So small cuts and bruises could be external, could be on the labia, could be inside the vagina, could be up by the cervix. But the scope is lighted and has picture-taking capabilities. And they document injuries so you can prove that the rape occurred. The SANE is going to record a precise description of injuries and location of injuries. She will document the presence or absence of semen. If there's semen still there, she'll collect samples of it. She will listen to the victim's statements, and those statements will be recorded in her medical notes as well. She will collect the victim's clothing to be analyzed by the lab. She also might be called upon to testify in court as to everything that she's done. That's the end of Chapter 10D. Once you finish this segment, I encourage you to continue on to Chapter 10E. Thanks and have a great day.